Finally, the M word, menopause. Most women fear it, but I'm here to tell you that if you're prepared, it could be the best time of your life. Debbie's here with us today, and she has a question to see whether or not she's going through menopause, right?
Yes.
Okay, so tell me, what's your question?
I've been having menopause symptoms such as night sweats. I wake up drenched. I'm having insomnia, which I've never in my life had before. Tiredness, forgetfulness.
Fatigue, all those sort of mood swing type of things.
And I'm not sure if I should be taking any kind of hormonal supplements or nutritional supplements.
Well, it's a great question, and what you have to remember is we women are hormonal beings. From the time that we're created, we basically are ruled by our hormones. So if you think about when you're starting to go through puberty and you had these changes before where you had mood swings and your mom was like, what's going on with you, sweetie? And you're doing that again, and you're having difficulty sleeping. And basically what a lot of women don't realize is the actual menopause has a definition of no period for a year. You don't need babies anymore. You don't need periods. We were perfectly happy without periods before they started, right? And then we had to worry about them all, when they started. So now we're going back to that fabulous time. So are you still having periods?
Not really. I've been having spotting for about past 10 months or so, but not real periods.
Spotting. So just right there, you're not in the definition of menopause. But if you really want to know, make sure you're treating yourself right, then you get blood tests. And we'll test for things like FSH, and if that's high, and that's predicted by what your ovaries are putting out as far as estrogen, then that is indicative of being in menopause, and as well as your estrogen or your estradiol, which is what we measure in the blood, being low, then that's also indicative of that. So we actually sent you to get your labs tested, didn't we?
Yes.
All right, and I bet you are just dying to know what it shows.
I really want to know.
All right, so your FSH was 12.9, which isn't really that high. Really, for menopause, it's about 30 to 40 range. And your estradiol was 162. So your ovaries are really still putting out a lot of estrogen. And this is typical of the time around menopause that we call perimenopause. This can last anywhere from like 2 to 6 years. So it can last for a long time, and that's when you have the symptoms. And basically, as doctors, we treat the symptoms. If you're having irregular periods, and they can go from being really, really heavy, shorter, longer, lighter, then we treat you with birth control pills, because guess what? You can still get pregnant. You may not have known that, but you can still get pregnant. So we treat you with birth control pills. Then there's other natural things out there like black cohosh for the symptoms, but you really have to talk to your doctor because it has to be tailored. Remember, as hormonal beings in that hormonal sort of state of mind that we are, we have to really treat things individually. Does that sound good?
Yeah.
So you have to take more calcium, you have to get a better diet, and you have to exercise more, and you have to do more sometimes to get that libido revved up. Because think about when we were young girls before our periods, we weren't interested in boys at all. And that's kind of how it goes backwards. Okay?
Okay.
Now, good. So now you guys are thinking like, I'm getting younger when I'm getting into menopause, right? All right. So you're prepared, you're ready to go.